a patient comes in seeking liposuction, we want to make sure that they understand what the procedure is and who's a candidate for it. It's usually a patient who has diet or exercise-resistant fat deposits. So a person who comes in who is, let's say, 70 pounds overweight, that's not a good candidate for liposuction. So I'll always advise that patient to lose weight. We can monitor them, have them come back. I've even written out exercise programs with them, exercise freak, for some patients, and diet, because I find that a lot of it has to do with diet. So after we've controlled, pretty much have a patient who presents who's a good candidate or someone who I see as a good candidate, we tell them what the procedure involves. Usually a general anesthetic is how I like to do it. And we do measurements of the person's torso, trunk, hips, and get an idea of what would be aesthetically a good balance for that patient. I do talk about power liposuction. I've been using it for several years. I think that it allows the fat to be removed a bit more evenly and easily. I show them some pictures, before and after pictures, so they get an idea of some of the expectations on certain patients with certain body types. And the final thing is we tell them that you have the procedure done, you're wearing compressive garments we do 4 to 6 weeks. The compressive garments help them, but they continue to lose volume for 6 months. So a patient may look great at 6 weeks, maybe even at 2 months, but by the time they get to 6 months, provided they stay on the same, a good diet, they walk, exercise fair, it doesn't have to be aggressive exercising, they can have several inch loss. I've had 4 or 5 inch loss around the hips over a 6-month period after seeing, let's say, 1.5 inches lost in that first month. So liposuction is kind of ongoing, and usually about 6 weeks they stabilize with regard to swelling, fluid shifting, and things like that.